nice to meet you, Megan. This is Simon.
Simon.
And I'm Carly.
Nice to meet you, Carly. And would you give me Simon's full name and date of birth?
Yes, awesome. This is Simon Peterson. He was born 10/21/2021.
All right, and we're going to ask you that a lot, and it's not because we forget who he is. It's just a safety protocol for our hospital, so we have the right patient every time we give medications, every time we do a procedure.
Okay, yeah, they do ask that a lot, so that's
Sorry.
okay. That's okay. Oh.
Do you mind if I do an assessment on Simon?
Yes. Simon has been really doesn't seem like he's himself lately. For the last 5 days, he's had a runny nose and a cough, and then
Dressing, is that okay?
yeah, of course. And then about 2 days ago, he started having a fever, and he wasn't really eating or doing anything. And then this morning he seems a little bit better, but still has the fever. So I thought I'd just bring him in and get him checked.
Okay. How is his eating?
Well, he eats really, really well, and he really did up until when he started the fever 2 days ago. He wasn't eating or drinking very well. It seemed to less than normal. But this morning he ate really good and drank a whole bottle. So
and
he
what
seemed
does
better.
he usually breastfeed?
He usually bottle feeds, and we are doing some. We do pumped breast milk, and then we've started in some baby foods with them. So
Great.
yeah.
And you always want to check what they're eating, because this is a great time to assess how they're doing, because they're meeting with a medical professional. So if he was drinking whole milk, it would be a time where I could intervene. So always make sure you don't assume that it's formula, it's breast milk when it comes in a bottle. All right, and what about his diapers?
He's been having his normal wet diapers. They
And how
seem to
many?
be, I'd probably say like 6 a day, maybe 7.
All right, and stools?
His stool has been normal, and he usually only stools like every couple of days, maybe every other day. And so he kind of seems to be his normal self.
Okay,
So.
that's good. All right.
Yeah.
Okay.
The other thing I forgot to tell you is he started to been pulling on his ear today as well. So that's
With
the other
anyone
thing.
in particular?
The left ear.
The left ear? Okay. All right, well, look at that.
Okay.
And when you first come in with a peds patient, you want to first do your pediatric assessment triangle to make sure they are doing well and you don't have to do any emergency interventions. So I'll look at him, I'll see if he's crying uncontrollably, if he's not conscious. I will look at his coloring, pale, does he have really rosy cheeks, is his skin look mottled, and then I'll look at his breathing. Any retractions, any gasping for air, if it's older child, if they're sitting up, and any of those things I would intervene right away and I would go for an emergency. But right now he looks great, so I'm going to proceed to a regular assessment. And I will go head to toe. It will change with older kids and what they're doing. So if he was sleeping, I would try to get all the things done that I could while he was still sleeping. If they're running around, I would ask all the questions I could to the parent, and I would assess what I can before I make them come sit down. If they want to stay with the parent, I would try to get all I could while they're still with the parent before I pull them away. All right, so we'll check his coloring. He looks great. I will fill his fontanelles. So he's 10 months old, so he should still have his anterior fontanelle. That usually closes up at about 1.5 years. If he was younger, I would also check his posterior fontanelle. That usually closes up by 6 months. So if it feels good, you're looking for a depression, or you're looking for bulging. Everything looks good. I would look for tears if he's crying, see how dehydrated. Most patients, peds patients, will come here for dehydration and respiratory. So we're gonna look for all those signs. We'll look at his mouth, see if how his mucous membranes, if they're wet. Look for nasal discharge. She did say that he had a stuffy nose, so I'll look at that. And then I can check cap refill. So I will, for peds patients, you're gonna check central, and you just push a bony prominence on their chest and count, just like you would do for an adult. And then you'll do peripheral, so on their hands or on their foot. And for peds patients, lots of times they'll shunt everything central, so you'll have a sluggish peripheral, and your central will be normal. Once your central gets sluggish as well, you know you're really into dehydration. So make sure you check both of those. All right, and then I can check pulses. He is an infant under 1, so I'm going to check the brachial. I can check the femoral, the pedal, and as they get older, you can check the radial. All right, and so his pulses feel strong everywhere. And then I am going to listen to everything. Okay, so I'll listen to his lung sounds and his heart sounds. If they're an older child, I would tell them what I'm gonna do. I might ask them to give them some autonomy. Should I listen to your heart first, or should I listen to your tummy first? You always wanna make sure when you're dealing with peds patients that you don't ask yes or no questions, because if they say no, then you're kind of stuck. So I will ask, when I'm checking their stats, I will say, which finger's your strongest? Which one can I use? And so then whatever they answer is okay with me, instead of saying, can I do this? And then they say no, and then you have to force yourself on them. So we're gonna listen to his lung sounds. All right, listen all quadrants. Listen, and I'll listen to the heart rate. And for peds patients, you do like to explain what you're doing, but you don't have to explain everything. Sometimes I'll say, I'm listening to your breathing, but then I'll also sneak in the heart rate, and they don't even notice. I'll listen to bowel sounds, and for babies especially, usually it's lower than you think. Adults, you're a little higher, but you're gonna go low, otherwise you're just gonna hear gastric sounds. So go low, and you listen. And then you can look at his breathing for peds patients. Remember, again, they're usually here for respiratory. So you wanna make sure you take off their clothes, lift up their shirt so you can see those retractions. See the seesaw breathing. Retractions usually start low, so if you don't take off their gown, you might not catch them early. So look here, look for their tummy. If it feels distended, if it looks distended, you can usually feel stool down there sometimes when they're constipated. Okay, so we listened. Also, when I'm listening, I'm gonna get my respiratory rate for an infant. Remember, infants usually breathe and have pauses in their breathing and breathe really fast and then pause or slow. So if you do it for just 30 seconds and then multiply by 2, you might not get the right rate. So listen the whole minute, count your respiratory rate, and that will be your rate. And heart rate, you can do it for the 30 seconds. It should be a steady rhythm. If it's not steady, that might be a problem. Otherwise, multiply by 30, or multiply by 2. Okay.
Multiply by 2.
Multiply by 2, not 30. Okay, so we got our respiratory rate, we got our heart rate. I'm gonna get my stats and my blood pressure. And make sure when they're laying on the table, you never walk away so they don't fall. Parents right here, make them closer if you have to walk away, or pull up the side rails. Blood pressure cuff. For a baby, you want to get about 50% from their elbow to their shoulder. This one is a little bit large for our tiny baby, but you would look, you'll have lots of sizes. If you're adults, you have a little bit bigger. So look for the one that best fits your baby. And one trick is leave that cuff in with your patient. So if it does change, if you have a really big cuff, it will often lead to lower blood pressures. If it's really small, it will lead to higher blood pressures. But if you keep that same cuff in the room with the patient, if it changes, you know it's the patient and not the different cuff that you're using that time. So keep the same blood pressure cuff for the whole visit. And sometimes doing a blood pressure can irritate the baby or the older child, so I like to save that one for later when if they cry, it's okay because I already did most of my assessment. So I'm gonna get a SAT reading, and we have different options for a baby. As they get older, you can use the finger, but babies tend to curl their fingers, their tiny fingers, so you do not want to use the finger for them. You can use one that will go on the ear. You just stick it on right there. Or you can use this one, and you will put it on the hand and just make sure the two sensors are opposite each other. So you can put it around the hand like this and wrap it with Coban. You can use this, or you can add some more Coban. Lots of times I'll do this at the very beginning of my assessment and let it start reading while I do everything else, and then it will come up. Or you can put it on the foot. Sometimes the foot is nicer because it's not wet and slimy when they're chewing on their hand or they grab at it. So this kind of keeps it out of the way. And you put it on there and then you'll get your sats. All right, so we have our blood pressure and we have temperature. All right, so for a baby, you'll usually do axillary, and you can put it under there and just hold it down. You can do rectal. Sometimes at the hospital you'll have a red one and you'll have a blue one. The red one you would use for rectal. Red, beware. And we got our temperature, 38.9, so a little bit of a fever.
Yeah, he's had a fever.
All right, and no any sweating. He doesn't look too sweaty. That's good, or bad, if he's really dehydrated. All
True.
right, pain scale for kids. Sometimes we forget this one because they can't give us a number until they get older. So you're gonna have to use different scales. So we have the cry scale for little infants. We have the flax scale that you could use, and we have the faces scale. As they get older, they can point to the different faces and tell you. And for the flax and the crying scale, you'll look at how their demeanor, and you'll rate with respiratory rate, heart rate, and you'll get a number. All right, so we got all his vital signs. We looked at him, we felt him. We talked about his history. Any past medical history I should be aware of?
No, he's been a super healthy baby.
Any allergies?
Nope, not that I know of.
Medications?
The doctor had us doing vitamin D.
Okay, all right.
We just give him those drops, that's it.
All right, okay. Well, I'm gonna look at his ear and do his blood pressure cuffs. So those two things might make him cry, so I'm saving those for the end. And to do those, I'm gonna wrap him up. But before I do that, since I'm gonna wrap him up, I'm gonna check the diaper. And usually I do the diaper last so I can leave him all clean with the parent. But I'm gonna do that now. So I'll check his diaper, and I will always tell the parent if we're doing strict I's and O's. Today, while you're here with us, we're gonna be weighing all the diapers to make sure he's getting enough hydration. So all I need you to do, if you wanna change his diapers, that is great with us. Just make sure the wipes you throw in the garbage, but save the diapers. Just set them on this table for us and we will weigh them. If you don't feel comfortable with that, just call us in here every time and we will be happy to change his diapers.
Okay.
So we'll change his diaper right now. I'll look for any stool, any urine. Even if it's not wet, I still am gonna do this assessment. And I'll still weigh it just in case there's anything in there. So I change it and I weigh it, make sure my wipes aren't in there while I weigh, and put a nice clean diaper on him. And I check all his genitals and make sure everything is looking great. Okay, so now we're gonna do the harder things that might make him a little angry.
Okay.
So I'm gonna swaddle him. Does he like being swaddled?
He loves it.
Oh, great. So we can use this blanket, and I'll usually fold the one little corner. I'll lay him on the edge, right below his shoulders. I am gonna do his blood pressure cuff on his left arm. So I'm gonna tuck this right arm under, and I'm gonna tuck it all under his body, and his legs. And I'll bring this one around so he's nice and secure. And then we will do his blood pressure. And wrap that. If it was an older child, I would tell them something fun like, this is gonna see how strong your arm is, it's gonna give your arm a big hug, we just have to hold really still. And I like to be honest about these procedures and tell them it is gonna squeeze really tight and it might hurt for a second, but if you hold still, it will let go. So we're gonna, and he's a baby, so I can't really explain that. So what I do is I snuggle him tight because this gives them the little comfort that we can't explain with words. So, and then I'll start it, and then I usually just hold them, talk to them, and hold their arms still so they can't keep bending it, and then you can't get a reading at all. And I'll hold their arm until it is done. And so we finish his blood pressure cuff. I do like to add fun things for the patients. They all have stickers on my badges that they can look at while I'm doing things, while I'm listening, especially when you're listening to lung sounds, so they can kind of be quiet for that. When I'm listening to their tummy, when they're in the hospital, you usually know what they're eating, so you can say, oh, is that oatmeal I hear in there? Is that a popsicle? And then they think you're superheroes that can read what's in their tummy. All right, so now I'm gonna check his ears. So I'll tuck that one little arm in. And one way, if you're doing it by yourself, you can have him laying down, and then I would lean over him, turn him to his side, and because it's his left ear that hurts, I'm gonna get a good look at that side first, just in case I only have one chance, I get to look in the side that is most bothering him. And I'll lean him back, and you wanna, for peds patients, you pull up and back. So I'll pull up and back, and I'll look as I'm holding his head this way. And then I'll check the other side, up and back, and look. If you have the parent and they are willing to help you, then you can ask the parent to hold the baby just to the side and have them turn their head like this, and they can hold like this, and you can have a good look and they're secure. And then the other shoulder for the other side. All right, and so you finish your assessment. I make sure I always end with the child happy, swaddled up. I will ask if they want me to put them in the crib, make sure I put the side rails up. If they're older, I'll give them coloring, bubbles, some activity. We'll find a show on TV that they can watch. Just make sure you leave them as happy as you can. Sometimes it's not possible. Sometimes they just hate you because you just did a procedure, but I try really hard so then the parents don't hate us every time we come in and think we disturb their baby and they despise when nurses come in. So I try my best. Would you like to hold him?
Yes, that would be wonderful.
Right.
Thank you so much.
Any questions you have for me?
No, he did good. That was wonderful.
Great. All right, well, I will be back soon. If you need anything, just call me. We'll be right outside, and we hope that you have a great visit.
Well, thank you so much.
Right.
Thank you.
Bye. Okay.
Megan did so good.